And welcome back. Respiratory diseases like COVID-19, flu, pneumococcal disease, RSV don't affect everyone equally. For adults and children living with conditions such as diabetes, heart disease, chronic lung disease, weakened immune systems, and other chronic illnesses, the risk of severe illnesses are significantly higher. With us today to help us understand is Dr. Sarah Sokol, president of the American Academy of Family Physicians. Good morning, Dr. Sokol. Thank you very much for spending time with us this morning. Could you tell people what is important for people with chronic health conditions to know about their risk for severe respiratory illness and how vaccines can help?
Absolutely. As a family doc, I'm seeing patients from children, infants, older adults. And when you have a chronic illness that you've like diabetes, high blood pressure, lung disease, as you heard, when you are exposed and get sick from a respiratory virus, both your underlying condition can get significantly worse and you're at significantly increased risk of complications like hospitalization, ending up in the ICU from those very respiratory conditions. But with appropriate vaccination, they're incredibly effective at changing what could be a severe life-threatening illness to mild cold symptoms if you've been appropriately vaccinated.
All right, well, why may there be different vaccine recommendations for children and adults living with chronic or ongoing health conditions?
So most of the respiratory vaccines that are seasonal are really targeted towards your individual age, risk factors, your own sort of risk of exposure, your past vaccination history and medical illness. So your family doc can really work with you, who knows your medical history best, to determine which vaccinations would be appropriate and even what time of year might be the most appropriate time to receive them.
All right, since you mentioned, what conversations should individuals have with their healthcare providers about vaccines that help protect against respiratory disease, including where to get them and their safety?
So I'm excited when patients come in with vaccine questions. It means they're thinking about keeping their family well and protected. You want to ask about the safety and efficacy of vaccines. They're incredibly safe and efficacious for you when targeted appropriately for your own medical history, and that I'm able to give the vast majority of respiratory vaccinations right in my office, but also local pharmacies and even local health departments may participate in providing vaccines to your community as well.
Oh yeah, we have plenty of that here. What role then do antiviral treatments play in helping people with chronic health conditions recover from a respiratory infection like flu or COVID-19?
So, if you find that you start to feel some respiratory symptoms during this high intensity flu, COVID season, please let your family doctor know as soon as possible. Within the first 12 to 24 hours, if you start a medication, an antiviral for influenza, it can help significantly decrease your symptoms, your experience of the symptoms of flu. For COVID-19, that if you start within the first 5 days an antiviral, it can even help you prevent complications and hospitalization. So there's a real early opportunity, but none of those opportunities are as great as getting vaccinated ahead of time. So if your viewers right now are realizing they haven't received this year's vaccine, today's a great day to go get your flu, COVID, and talk to your family doc about other appropriate respiratory vaccines based on your risk factors.
Would you say then that, in order for these to be most effective, it's a good idea to be proactive?
I'm always about prevention. So family docs want to collaborate with you to really think about in your life with your health, your nutrition, preventative care and vaccines. How can we prospectively prevent you from getting ill? And how can we also help you if you find yourself having fallen sick? I'd also encourage you to use, public resources, the familydoctor.org and cveep.org are immunization websites that provide you some good information to start with of what questions might you want to bring to your family doc about what vaccines might be right for you or your family when you're thinking prospectively and prevention.
All right, look for yourself, but also speak with your health provider. Doctor, thank you very much for being with us this morning. We do appreciate your time.
Thanks so much.
You have a good day.